Yeah, my name's Ken Duckworth. My pronouns are he and him.
My name is Ava Dulesky, and my pronouns are she, her.
I'm JJ Vera, and my pronouns are they, them.
I'm Dr. Elise Dulesky, and my pronouns are she, her.
Ava, I'd like to ask to start with you about your journey around gender identity and how that has um, interacted with your mental health journey.
So, before I start, I just kind of want to preface this a little bit by saying that, I'm speaking purely from my own perspective. My trans experience is not the trans experience, so everything you hear is just very much me personally, and, everybody might have a different sort of experience about it. But um, I do think that these are separate journeys, but they're journeys that do interact. The struggles that come with each are unique to their own. I think if you're doing things to improve your mental health and your mental health is negatively affecting your gender journey, then then you are in effect helping your expression and your transition in and of itself. I have been dealing with depression for a very long time, and I would say that starting to transition and and actually express myself in a way more congruent with who I am has helped significantly alleviate the symptoms of my depression. Has helped make the depression less severe.
Thank you for kind of laying that out because it does make sense. And JJ, I wanted to ask you about your experience of how your mental health history has impacted and been influenced by, if at all, your gender journey.
Yes, of course. And again, I'm always very careful to not say one causes the other or that it's because of it, because then you see people that think like, okay, my depression is rooted in my transness. If I address my transness, I'll no longer be depressed.
Right. You don't want people to make that assumption.
Correct, because once you deal with and acknowledge the transness, there's a whole new road to travel down, and your depression is still going to be a part of you. It's more like it's easier to breathe. Now you can see and control these things and acknowledge them and deal with them. But for me, it's like I feel like personally, it's been about my mental health first. So there's a part of me that's always dealt with the major depressive disorder, and then the PTSD obviously came with lived experience, and um, finding my gender journey to be my own and to not be the thing that will fully heal me and solve all my problems was really important because I was able to remove myself from an unsafe situation, start my life over, dress the way that I wanted, make the friends that I wanted, live the life I wanted. But the depression and anxiety and trauma was all still there. It's just now like I'm not in a chokehold. I'm still just learning how to breathe on my own again.
That was very well said. And it sounds like, again, we get back to this idea that for a provider or a family member, that your individual journey is your individual journey, and taking the time to listen and understand for you how your mental health experience and how your gender experience interact is
Correct.
critical for both of you.
It is not a cookie cutter experience by any
It's
means.
definitely not a cookie cutter experience. There's no one size fits all. Elise, you're a mom, you're Ava's mom, in fact, and a mental health professional. So I'm interested in your perspective as a family member and as a therapist.
I work with gender expansive clients, and I have to kind of put on that hat. And then when I'm talking to my child, I have to remember to take that off and,
Mm.
put on the mom hat. Um, I can let my clients know and the families know, hey, it's not that I studied this in school. It's not that I, read a book about it or saw a webinar and I feel like I'm an expert, but it's a lived experience for me. And I can understand how family members are impacted by mental health and by gender diversity. And so I feel really authentic when I'm able to share that with my clients.
So it's really the integration of your family experience with your professional experience, as I hear it.
Yeah.
So, Ava, I wanted to ask a little bit about your experience. And again, we're only speaking for our own experience, an N of one, not for the entire community. Your experience with healthcare and mental health providers.
So I've personally actually had a really good experience with healthcare and mental health providers. I haven't had any major hiccups or anything. I credit that partially to one, having a very understanding mother in the in the field to kind of help guide me a little bit with who to pick, but also just picking out therapists and psychiatrists and just general providers that do actually say oh, we're LGBTQ friendly. In my experience, I have actually found that those who do who are confident about selling themselves that way have been rather helpful to me and have been very willing to listen. And that is a very important thing that I think I would want to emphasize, is especially because it's such an individualized thing, that, it's important to listen and to not assume just because oh, maybe they have another trans, client or patient, that it's going to be something similar, because it might look quite different, actually. It's important for the provider to sort of be in sync with what they with what that person wants and needs. And I found that personally in my experience with providers, I have been given that space to speak and to be heard, and I do feel like it is something that they have understood for me.
How did you identify providers who were LGBTQ plus friendly, positive, engaged? How did that search process go?
I was looking at profiles on Psychology Today. They have a section for therapists, they have a section for psychiatrists, and they'll have these bios there, and it'll say what they're experienced with, what their what their credentials are, where they went, even all that. And part of that will typically, if there's not a tagging system, because there might be a literal profile tag saying LGBTQ friendly, but it might also just be mentioned in their information.
It's interesting, Ava, back in the day, the training for the therapist, and I don't know if you have had this experience, at least, was to not be out there in terms of what you were open to and who you were, your own professional identity and how that relates to people. And I think like Psychology Today, Zen Care, where people list who they are, they might have a picture of themselves, further sharing their identity and what they're interested in serving people about, I think is a real step positive. And it sounds like that has worked for you.
Absolutely.
JJ, I wanted to ask about your experience with healthcare and mental health providers.
I have a varying experience just based on, I guess, proximity. The experiences I was having living at home in Rockville, Maryland, very much vary to the experiences I was having in Washington, D.C., where I am now. Only 45 minutes apart, and yet the competence and the information and the education to LGBT plus care, I found was much more available to me here. And I've used Psychology Today, and I feel like the more I try to find a specific to me kind of situation, I see the results get smaller and smaller and smaller because I feel more and more niche based on what my situation is. But if I go to Women Walker, who we know is established as a LGBT support center for healthcare and wellness, it was easier. And I think visibility, as you said, is extremely important. So to see that this is a space that is encompassed within its own employees and staff, that these people reflect my community, that makes things definitely easier. And I think that's that's the major difference to getting good care versus not good care, is that there's the sense of community awareness that we're all on the same page.
You raise an interesting point, though. In many metropolitan cities, there is a program or healthcare system, that leads with its identity in the LGBTQ space. In Boston,
Yes.
That happens to be the Fenway Health Center. That's a place that I could be assured, my patients would get thoughtful care. And I think that may be one tip from this conversation is to seek out that center, even though these places may not be perfect. The chances that they're going to be sensitive and integrative around this are much higher.
I realized, oh, okay, if I go to like more metropolitan or even wealthier areas, I'm going to get a better quality of service as far as awareness and resources. Like when I was like hospitalized for like a pretty big like mental health scare, people were prepared. The pronouns were immediate, and on every single piece of paperwork that followed me around, like people saw pronouns with my name, they saw the chosen name, they used it.
What experiences have you had at less sophisticated facilities?
Like back home in like a smaller town, if I were to go to the local hospital there, it's just like there is no like outward facing like, hey, we see you. This is what we have to offer. It doesn't include us. It doesn't. We don't see ourselves in there, like in their programming or their services or what have you.
Thank you. Elise, what's been your experience of, the professional world and your interactions with healthcare and mental health professionals?
Well, I guess I can preface this by saying I practice in the state of Texas currently, and I have practiced in other states earlier in my career, and it really is different based on where you are and what the predominant social climate is, political climate. But that is actually one of the things that motivated me to want to put that out there and say, I'm here, I have a safe space for you, I'm, not going to try to change you. And I do wind up getting quite a few clients who come to me telling me about other providers that they had seen who had a different take on it. And so I offer supervision to providers in the area. I have a group practice, and I provide trainings, and also make sure that I hire people only who are, have an open mind and are willing to learn, because for people who haven't had the personal experience, they don't have anywhere to draw that from. So I usually make suggestions about joining professional organizations like the LGBTQ Chamber of Commerce, just to be more active in the community and get to know people. Because I think therapists need to get to know and understand the LGBTQ experience on their own time and not expect it to be from their clients to educate them.
Yeah, what about this? So Ava, I want to go to you. What would healthcare professionals benefit from learning? Let's say they haven't had a first-person experience. They don't have a family member. They haven't lived with this in any way. What might you encourage them to get in their training?
The very basic sort of step one is name and pronouns. Like make sure that, you are addressing people the way that they feel is correct. And there needs to be like a lot of listening and individual, I like kind of how JJ was saying, like talking about treating people as individuals and individual cases and not like, you're in this bucket of like, how we treat this kind of person. I feel like well-meaning providers may put a little bit too much emphasis on these two things. One is quote unquote passing, and then the other is on coming out. So when it comes to coming out, I think, well-meaning providers may have this perspective of, it would be a definite sign of progress, and it would be, it would be ideal to come out as fast as possible or faster so that everybody knows it can start coping with it and understanding and then starting to become an ally. But I think there's something that can be missed, which is that people know when they're comfortable coming out to who they come out to. Because, for example, personally, I didn't come out to everybody at once. I came out to my very most innermost circle of friends first, and then it was my family, and then it was the people like my peers at school, and then it was like, you know, my like professional life, like, you know, my potential coworkers, things like that. And that was just a different tiered thing for me, because that was the order in which I felt I was comfortable doing that. And I, you know, I didn't want like somebody like kind of pushing me out of the closet in a way, because that transition can be, that social transition can be a lot to take on at once.
Okay, so the provider should respect your journey around how you structure coming out, because you made it pretty clear that might be different in different circles.
Right. Yes. So that is one thing, is sort of kind of being understanding of that pace. And then the other thing, okay, so first of all, passing is somewhat rightly a bit of a controversial term, because what even is passing? You know, it's sort of traditionally defined as, you know, when the non-involved sort of cis straight heterosexual person, you know, would be most likely to view you as the gender that you are. But part of the problem with that is, first of all, that is incredibly subjective. You know, different people have different ideas on what they think a man, woman, or androgynous person looks like. And second of all, our society is broadening the visual definition of what it means to be quote unquote masculine, or what a man looks like, or versus what a woman looks like. And so as a result, you don't like, it's not really fair to say like, oh, you know, you're gonna you should focus on passing so that you look like this, because you might be pushing them into, you know, an ideal, like this societal ideal of femininity or masculinity or androgynousness that's not necessarily even there. And it's also important to recognize that being trans is not an aesthetic. It's not something that is always about the appearance. It's a social thing. It's a societal, you know, it's a combination of the lens in which you view the world, and also, you know, the interactions and the performance that you have around other people.
So Ava, I'm impressed by your points about coming out, your points about passing. Sound like they reflect the idea that the provider isn't attending, isn't listening to you, and letting you kind of run your own journey. Is that the common thread you wanted to get across?
Yes, exactly.
Elise, what have you observed in your travels with mental health professionals? What have you learned, and what would you like healthcare professionals and mental health professionals to learn or to know?
I think we do our clients a great disservice when we do kind of lump them all together. Even that there's an LGBTQ plus, you know, umbrella is on the one hand wonderful, and on the other hand, I think for people who don't have exposure to the community and knowledge and understanding of who people are in the community, they kind of make that, oh, okay, it's an LGBTQ client. And I kind of don't look at it that way. It's, what is this client coming in for? So for me, I there's a very positive trend I'm seeing in that, you know, I'm seeing mental health providers who are identifying, you know, themselves as members of the community, and not just that they serve the community. And, you know, that was so taboo back in the day. You don't disclose. Yes. And,
big improvement.
Now, yeah, totally. And, you know, they're sharing their pronouns. And so I think that's wonderful. And, you know, but it's not limited, of course, to people who are, like I said, in the community to serve the community. You can still serve the community. But just to really keep in mind that there's a quote someone had said at one point that I just love, and it's, you can't understand while you're judging.
And you're also engaging your cognition and not your compassion, right?
Exactly. One of the biggest gifts I think that we can give as therapists is that compassion and empathy, and, you know, create a loving environment, because so many of our clients come in and they're not coming from a loving, accepted environment. I mean, my gosh, therapy needs to be that place, if nowhere else, right?
All three of you have really emphasized this idea of treating the individual, that each person is their own individual, and their journeys might be different. Elise, you mentioned pronouns, and so did you, Ava. I want to just talk a little bit about pronouns. Let's go to Ava on this question.
I think that it's important to obviously like know somebody's pronouns, use the proper pronouns. But it's also kind of worth talking about, when somebody accidentally uses the wrong pronoun. That is something that will happen, and a lot of the time it doesn't come from a place of malice, and so I think intent is everything when it comes to pronouns, because mistakes happen, and it can be an emotional thing for people, especially if they come from a household, or have like a somebody another circle where they are being misgendered, and where they are sort of having the wrong pronouns used pointedly. Then it may be that they have a bit of a more emotional response, or more of a they might have a little bit less patience, and that's not to say that that's like ideal or a good thing, but it is something to consider and be understanding of, because at the end of the day, like it's not something that at this time in this society everybody understands.
I like this idea that intent is important to you, because some people with gray hair, like me, weren't trained with this in mind. And if we've taken classes to try to understand it, we may still fall short. And I like that idea, that intent, because I think most providers, most professionals have very good intent. That's my experience, but may not have the vocabulary or personal experience. So intent is important to you, Ava. JJ, what is your take on pronouns?
I also agree wholeheartedly that intent is everything. And, just because there is not the understanding doesn't mean that there is malice being inflicted. And that's important for both parties to understand. It's just not always the case. So I very much acknowledge and have compassion for, the trans person or the gender diverse person that has lived like a very difficult life regarding like pronouns and identity being respected. Of course, that person's going to be more on the survival side and less patient, more intolerant and wanting to be understood. And I think understanding that that's something to expect from some people is important, because then how to dismantle those situations as a provider. And so I agree that intent is absolutely so important, and I think it's critical on both sides.
I wanted to ask the three of you about your experience of culture. Of course, in different geographic parts and different cultures in America, right? People have different response to this idea of gender identity and resilience. And I just wanted to ask each of you your experience of that. Ava?
Well, I can speak more geographically than anything, and it's one of those things where like it's going to be imbalanced, because different regions do have different cultures. But as somebody who grew up most of my life in Texas and then recently moved to Phoenix, Arizona, a big city in the middle of in the heart of the American desert, I have noticed a difference. I have noticed a difference with regard to my gender and how that is viewed. I've noticed in Texas there's a lot more like sort of looks. And, those looks I feel a bit conflicted on, because on the one hand, it's like, if there's some attention to this, I clearly am not like very, like this isn't a common sight or anything. So I feel like kind of being present and being visible and bringing attention to that in a way can be good, because it like shows that like, hey, I exist. I'm going around and I'm not gonna, try to censor myself or conform. It can be like a bit of an activist feeling sometimes just walking around in Texas. Like on the one hand, I am all for like, this sort of activism of staying somewhere and saying like, hey, a person from Texas can look like this, like that's fine. But on the other hand, it's hard on the individual at times, because it's like I know that a lot of those looks I'm getting are kind of people who feel weirded out, or people who don't understand and aren't really being respectful to me. It doesn't, it doesn't always feel good.
Right.
And
It sounds like a real burden sometimes.
yeah, exactly. It can be a bit of a burden, and it can be frustrating, because at the end of the day, like, I don't really feel fundamentally any different than any other woman. So the fact that like people are kind of clocking me and looking at me like I'm something different, like I'm some kind of exhibit, is it can be a burden. So it really is kind of both.
And how has your
that way.
experience in Phoenix been different?
Much better.
How so?
Much better. In that I notice first of all, there are people who are familiar enough to, like, if they ever aren't sure, instead of just assuming, they'll ask my pronouns. And if they ask pronouns, then I already feel a lot more comfortable, because I know that they're going to accept whatever answer I give them.
JJ, I want to make sure we get your thoughts about culture.
As far as culturally, I'm very lucky to have been in this country, to sort of like to have the upbringing I did as far as my surroundings, right? So both my parents are immigrants. They're both indigenous Latin people, like Latin A people. And so the fact that there is no gender neutral in the language itself, or in any Romance language for that, automatically creates a huge problem. Even inanimate objects are gendered, so that table is going to have a feminine, like gendered ending to the word for table in Spanish, even though it's a table. And so like that for me is like super important.
Do you think it's improving in the Latin culture, either of these dimensions?
I want to say yes, because we've included the E into the gendering of words. Like you see like Americanized first generation Latin people creating like terms Latin X to try to be inclusive, even though that does literally nothing for the language, and people that speak Spanish cannot use that. It does not make sense. So we're looking at like Latin A versus Latina, Latino, Latina A creates sort of that extra room to have like third gender, non-gendered sort of representation. So I've seen strides be made. It's a lot of trial and error linguistically, and I've seen it change. I used to use Latinx all the time. Then I realized it was very much just like a whitewashed approach to bringing gender sensibilities into language. And so like I think that's changing at a glacial pace, but it is happening. More people know now that like transgender people exist and that they're not going anywhere, that androgynous non-binary people are real and matter, and all that's changing is the language is evolving, and so I think that is sort of like a huge tip to progress.
Well said. Elise, you mentioned the culture of mental health in Texas and your specific reason for wanting to practice there. Any other observations about the culture that you exist in?
I feel like it's very important for me to be culturally sensitive and keep in mind either the client or their family's cultural experience. I have to first be educated about what is their cultural background. And culture could mean anything from ethnicity to religion to whatever, where geography. I mean, it's culture, right? We have family culture, and that's separate from everything else. So I like to understand and explore what my client's culture is and how much acceptance or rejection they've experienced. And then, is that exacerbating any mental health condition, or is it completely unrelated? Because it's not fair to assume.
Ava, what would you like healthcare professionals to know?
Just listen. Really just listen. And be ready to provide resources, like local, gender, like centers and support and everything. But at the end of the day, just listen. That's my main thing.
Thank you. JJ, What would you like healthcare professionals to know from this conversation?
I would like mental health professionals to know that gender diverse and trans issues are not niche and something I think everyone who is providing care should know about extensively. So while it starts with the individual, I think the provider uh, should have a much broader scope of this issue. And if that means having queer friends and reading gay literature and doing the personal work, then I support that.
Elise, as a family member and mental health professional, do you have any perspectives on what healthcare providers, mental health providers, should know?
Well, I think that to really have high quality mental health care, it needs to be a whole person approach, and educate yourself, learn, and I think that a whole person approach means not just focusing on what mental health issue they said they were coming in for, not just focusing on their gender identity or dysphoria or any, thing that might be present, and not focusing on just their family or just, but all of it, to look at the
The whole
complete picture
person.
that makes that person. Yeah.
All right, thank you. I want to thank you for joining us today. It's been an opportunity to learn a lot about gender expression and the interaction with mental health. On behalf of the National Alliance on Mental Illness, the SMI advisor, I want to thank you for your time. So for Ava, JJ, and Elise, I want to thank you all for being part of this conversation.
Thank you.
Really, really appreciate it. Thank you for having me.
Thank you so much for including me.